Hi, I'm Stacy Tignano, and I'm here with Dr. Dimpy Shah, and we're the co-chairs of the Patient Advisory Council for the CCC19. While vaccination is highly recommended for all individuals, we also recognize that one size fits no one, and we hope the following Q&A with Dr. Peter Hotez can answer some of your questions. Dr. Peter Hotez is kind of a doctor of everything, but more specifically, he is a professor of pediatrics, molecular virology and microbiology, the dean of the National School of Tropical Medicine, and a health policy scholar, all at the Baylor College of Medicine.
Thank you, Dr. Hotez, for meeting with Stacy and myself. We are really appreciative of your time, and you have been such a reliable and consistent source of information on COVID during this pandemic. Please give us a summary of your message for the community.
Well, thank you, Dr. Shah. I mean, the message is going to be on the urgency to get vaccinated, and we've lost too many Americans this year who are resistant or defiant of getting vaccinated, and that's taken a terrible toll. For instance, here in Texas, around 20,000 Texans have needlessly lost their lives since June 1, despite the widespread availability of vaccines, by refusing to get vaccinated, and the number's 4 or 5 times that nationally. So the fact we've had this catastrophic loss of life, that's been totally unnecessary. So that's a key message, and also updating people about the new Omicron variant, how we combat it, what the vaccines can and can't do, and then talk a little bit about what we need to vaccinate the world and to prevent additional variants of concern from emerging.
Thank you. And could you discuss a little bit more about Omicron? I know we don't have a lot of information yet. I also read about your interview that says that Delta variant is still the villain, and we need to be doing our best to vaccinate. What other precautions do you think the public needs to take, especially patients with cancer, with those who have compromised immune systems?
Well, first of all, the Delta variant is still with us and will be for the foreseeable future. It's highly transmissible, and it's very good at attacking the vulnerable meaning people who do not have an immune response against COVID-19, either because they're unvaccinated or under-vaccinated. And of course, the same is true with Omicron. Omicron has the additional feature, though, of causing high rates of reinfection among people who've been infected and recovered. And so whether or not you're concerned about Omicron or Delta, the course of action is the same. And that is, if you've not gotten vaccinated, now's the time. Certainly it's already past that, given all the loss of life we've seen among the unvaccinated. But even among individuals who've gotten 2 doses of the vaccine, with waning immunity, we're seeing breakthrough cases of Delta, and we're going to see high rates of breakthrough cases of Omicron, we suspect, because of all the mutations in the spike protein. So getting that third immunization is really important if you've gotten 2 doses and you're eligible. Now's the time to do this. Also, if you've been infected and recovered, we're going to see lots of Omicron reinfections. Get vaccinated even if you're infected and recovered. There's a buzz out there that says so-called natural immunity is better than vaccine immunity, and it's not true. So if you've been infected and recovered, getting vaccinated on top of that will build in greater resilience to any new variants. And there are actually studies to show this phenomenon of epitope broadening, studies out of Rockefeller University. And lastly, get your kids vaccinated, because now we're seeing a lot of pediatric infections in South Africa with COVID-19. So if you've been holding back on vaccinating your kids 5 and up, now's the time to do it.
Thank you. We really appreciate that. Do you have any information about vaccine efficacy against Omicron, after the 3rd dose? And
now that's the question everybody's asking, and we just, it's too early on to have that, either through vaccine effectiveness studies or in studies in the laboratory. And so, for instance, with our vaccine that we hope will be released for emergency use in India soon, where it's known as Corbevax with biological E in Hyderabad, The way this works is you take serum from either experimental animals or people who've been vaccinated, and you look at the ability of those antibodies to neutralize the original lineage, which the vaccine was made to, and see how far the decline is of the virus neutralizing antibodies against the Omicron variant, either as the virus or a constructed pseudovirus that's made in the laboratory. And those experiments are underway in our lab for our vaccine, but Moderna, Pfizer, J&J, AstraZeneca are all doing the same. So in the next week or so, we hope to have some preliminary data to see how far the drop is in virus neutralizing antibody. And my hope is it's not too much of a drop, meaning that we'll get a good indication that 3 immunizations, because it gives you that 30 to 40-fold rise in virus neutralizing antibody, will be sufficient, but we don't know that just yet. And in addition, bona fide vaccine effectiveness studies in the field will also be done. So we are going to learn a lot more in the coming week or two. I know it's frustrating, but in the meantime, you should stack the deck in your favor by getting vaccinated to the max, meaning 3 doses. If you've been infected and recovered, get vaccinating your kids.
And I know that the patient community's been questioning this. You're mentioning antibodies, and individuals have been asking whether or not they need to have their antibodies checked prior to getting any 3rd dose or booster shot. Do you have thoughts on that?
The answer is don't, because unless you're enrolled in a particular research study supported either by the companies or the NIH, most of the COVID antibody tests are not designed to look for antibodies to the vaccine. In fact, some of the antibody tests don't even measure antibody to the spike protein. It measures antibody to the nucleocapsid antigen, and you can get a false negative. So I know a lot of physicians or patients are curious. They want to know, they want to confirm they have antibodies, but right now there's no licensed test that specifically measures vaccine immunity. So docs have been using it as a surrogate, the COVID antibody test for previous infection. And I'll often get sent from an individual by email a number from that test. And to me, it does not have a lot of meaning because that's not what the test was designed for. So unless you're enrolled in a specific study, for instance, here at Baylor College of Medicine, one of our scientists, Tony Piedra, has a group that's doing a study to actually look at the antibodies designed specifically to measure, a study that actually is designed to measure antibodies against the vaccine to get that information. And likely other academic health centers have that as well. But the general antibody test for COVID should not be considered a substitute for that, and should not be used as a decision maker for clinical decisions.
Thank you. One more question, with regard to that. I think your statement was very, very clear. Even if you've had a previous COVID-19 infection, that you still should pursue vaccination. If an individual has gone through what's considered full vaccination, so 2 doses of Pfizer, 2 doses of Moderna, a dose or 2 of J&J, and they've also had a what would be considered a breakthrough infection, does your recommendation change, or do you believe they still should get a booster?
Yeah, well, right now I have not seen published data to make a recommendation one way or the other, and so intuitively, I would still get vaccinated on top of the infection, and the reason is based on some studies from Rockefeller University, from Michelle Nussenzweig's group and others, not that exact situation, but showing that people who get vaccinated after infection show a lot of epitope broadening. But I've not seen the converse. I've not seen the people who've gotten vaccinated that have breakthrough infection. So,
okay. Is there one vaccine better than the other if there's a breakthrough infection? Say a patient had 2 Pfizer doses and had a breakthrough infection, are they recommended to get maybe Moderna, or is there any benefit of switching Thanks.
Well, I think there's benefit of sticking to what you started with. So if you started with 2 doses of Pfizer, finish up with Pfizer, or started 2 doses of Moderna, finish up with Moderna, for the simple reason there's going to be a lot more data available. So either from the companies or the CDC, they'll be collecting data. The companies, for instance, have no incentive to look at the response to a heterologous boost. So if you're at Pfizer, you're not going to embark on a study to look at what happens when people choose Moderna as the 3rd immunization. And so just from the fact there'll be less data available and more difficult to make informed decisions, all things being equal, I would kind of stick with what you started with.
Thank you.
There's another question. I think it's pretty pervasive. It's definitely pervasive in the cancer community, but I think it's pervasive in the general community too. And that's regarding side effects of the vaccine, not some of the scarier things that people have been doubling down on, but actually the reverse. And if individuals get vaccinated, get their second dose, get a booster shot, and don't have side effects, does that mean it's not working for them?
No. The side effects primarily are not. I mean, if you look at the 2 major arms of the immune system, the innate immune system and the adaptive immune system. The adaptive immune system is, the antibodies and the T cells that you make, but the innate immune system is based on the triggering of what's called TLR receptors, toll-like receptors. And that's the reason why you might have shaking chills, or you might have fatigue due to the inflammatory response, because the toll-like receptors help control the inflammatory response. So the fact that you're not visibly symptomatic does not mean you won't. I know too many double negatives here, but just because you're not having symptoms doesn't mean you won't develop a functional adaptive immune response. So that has not been, so your extent of whether you're shivering or tired of arm soreness has not been a predictor, as from anything I can see, of how well the vaccine takes and you respond.
Excellent. Thank you. Thank you. And I know that while we try to encourage everybody to get vaccinated, get boosted, wear their masks, we're still running into challenges depending on where people live for that to be something that the general community is doing. People are really leaning into some of these at-home tests. Do you have any thoughts about at-home testing, especially leading up to the holidays? People are going to be gathering, even if they're vaccinated. Just any general.
I think we've never really gotten testing up to speed like it is in Europe, where you can just go to the local pharmacy and get a subsidized kit for $1 or a couple of dollars and do it at home. I mean, we've made like so many things about our healthcare system, we just don't tolerate a lot of fussiness. And so the minute we tend to make things overly complicated, and then it doesn't get used. And I'm afraid that's going to happen again with home testing. So for instance, the Biden administration announced as part of their 9-part measures to get ready for the winter Delta wave and Omicron, that they're going to make home testing reimbursable by insurance. And fine, I think that's fine. But, to start now more filling out forms and making requests and tracking down the reimbursement, it's just not the same as walking into CVS or Rite Aid and say, here's $2, give me the home test. So that's a little disappointing, but I guess it's better than the situation that we had before.
So just to ask the question a little bit differently, if individuals are concerned and they do have trouble getting a test through their healthcare facility, are the over-the-counter, if they have the means to access them, are they a good, second choice?
Yeah, I think there are reliable tests now, and otherwise they wouldn't be licensed. And that's a good discussion to have, rather than go into this on this Zoom chat. I would have that discussion with your pharmacist, who should know the the advantages and disadvantages of the different tests, some being more sensitive to others. For instance, a PCR test is usually a little more sensitive than an antigen test. On the other hand, the antigen tests tend to be a more rapid turnaround, so there's trade-offs of one versus the other.
What are your recommendations for the holidays? People, we are going almost into the third year of the pandemic and there is fatigue all over. So what are the best measures for, having safe holiday gathering, especially for patients?
Well, I think, one, you should be fully informed by your oncologist or specialist what your situation is in terms of the possibility of your being immunocompromised. And depending on that, you may unfortunately need to greatly limit your participation in holidays, or have a very or hopefully have a very understanding family that can make that accommodation. So generally speaking, let's put aside individuals with underlying conditions that make them more susceptible for a minute. In general, we're looking at a pretty rough winter, I think, and both because of the Delta variant's going to start to accelerate again, I think is likely, and now we've got the Omicron variant that's highly transmissible. So in general, I'm suggesting don't be overambitious this winter holiday. Try to keep the gathering small. Try to ensure that it's people and are fully vaccinated. And my personal definition of full vaccination has changed to 3 doses of the either mRNA vaccine, although that's not the official CDC definition. They still maintain the 2. I don't think that's going to be adequate anymore. I always thought of this as a 3-dose vaccine. So everyone who you gather with, ideally, if they're eligible, 3 doses, and if they're with kids, get them vaccinated if they're over the age of 5. Try to keep the gatherings modest in size. The more things you can do outdoors, of course, the better, but that can vary a lot depending where you live. Here in Texas, we can get away with a little bit more this time of year. It's quite nice, but as you get up further north, that becomes impossible. But keep the door open and ensure you're in a well ventilated place. So those are the big, and then you have to think about travel this winter holiday and be mindful of your situation. And that means know something about, I don't expect you to become an epidemiologist, but know something about what's happening in your community in terms of transmission. And it's easy enough to find. You can go to the New York Times COVID tracker, and you can look up what's happening in your county, or go to your state health department website or your county health department website, so know what's happening at that time, and also where your guests are coming from. So if your guests are coming from an area where things are really accelerating, that's something to keep in mind as well. So again, the expectation is you're not required to obtain your master's in public health in order to hold a Christmas gathering, but you do have to, ideally be somewhat mindful of what you're doing. And then if you are affected by cancer, or you're on chemotherapy or on immunotherapy, have that discussion with your oncologist or your specialty provider and get a better sense of how much you're at risk, because it varies. So for instance, solid organ transplant patients tend to respond least and sometimes to vaccines. So there's different gradations of how immunocompromised you can be, and it's your specialty provider who'll know that the best.
Thank you. That is really informative, and I think that clarifies a lot of our questions, right? Stacy, do you have any more?
No, I really want to appreciate your thank you. We really appreciate your time. And I think maybe just for posterity's sake, helping everybody understand that even though we've been in this pandemic for almost 2 years, that things continue to evolve. And so if 6 months from now, there's a new booster, as a virologist, as an infectious disease person, but does that seem reasonable to you? Does that mean that we've, missed the mark the 3 other times?
Well, first of all, whether or not an Omicron booster ever materializes is not clear. There's a lot to know in terms of the regulatory hurdles for it, whether it actually works. It's not a slam dunk that it's going to actually work. So I would kind of factor that out of your thinking right now. And the reason I say that is I'm hearing from some individuals, hey, I'm going to hold off getting my third immunization because I'm going to wait for that Omicron specific booster. Don't do that. No matter what, that third immunization will keep you safe from Delta and will likely have a spillover antibody effect from Omicron. And it doesn't prevent you from getting a booster later on that is Omicron specific if it becomes available. But it's still, there's still so many reasons why that may never materialize. So don't count on it.
Excellent. As we mark 1 year since the availability of the COVID-19 vaccine and nearly 2 years since the beginning of the COVID pandemic, we recognize that individuals with a diagnosis or history of cancer may have additional questions or concerns about balancing their treatment and vaccination timing. We've also created a question set available on the CCC19 website to help you guide a personalized conversation with your healthcare team as you determine what works best for you and your family with respect to COVID-19 vaccinations.